Suicide hotlines have been overwhelmed with calls during the coronavirus pandemic. Now doctors are worried the virus could lead to a large number of deaths and people who aren't even COVID-19 patients. Chad Mira with our sister station KNWA spoke with a local doctor today about growing concerns over everyone's mental health.
For the last couple of weeks, we've been bringing you in-depth interviews with doctors, answering all your questions related to COVID-19. Today, though, we want to focus on your mental health as well. Joining us once again, Dr. Gary Berner with the Community Clinic of Northwest Arkansas. Dr. Berner, thanks for your time again today.
Absolutely. Happy to help however I can. Thank you.
That is an important topic today. New unemployment numbers out. 3.3 million Americans filing for unemployment just this past week. Now some economists predicting unemployment could reach levels we haven't seen since the Great Depression. And that's a time when suicide rates spiked. So we want to talk a little bit about mental health. Could we see a similar effect now if these unemployment numbers and health concerns continue to increase?
Yeah, I had not heard that number. That is absolutely staggering and very concerning. I think between the stresses of the rate of infection increasing, the stresses of people losing their jobs or having reduced work hours, concerns about daycare and how to get their own child care, and then concerns about the elderly and our grandparents. Anxieties and stresses are absolutely on a high. Combine that with, many of us feel stuck indoors. We can't do the things that bring us meaning and bring us passion. We can't get out and work. Music, sports, activities, gyms. Many of us aren't comfortable going out to parks. And so with all those pieces, mental health is actually absolutely going to be on the rise.
It's a difficult time right now for a lot of people, and suicide is an issue that greatly affects our state. Even before this pandemic happened, last year nearly 550 people died by suicide, the leading cause of violent death. Now we have these added stresses in our lives. How important is it that we also try to address issues of mental health right now, even though there are obviously other health concerns we're facing too?
I think it's absolutely important, and I think if we are trying to do a really good job of social distancing and isolating ourselves in the same sense, that's going to feel isolating, and then you're going to be at home worrying about your friends and your family members. So I think it's critical to pay attention to that. I really highly recommend finding activities to help bring some joy to your life and bring some meaning in your life during this time period.
So how can I recognize, say, some signs of anxiety or depression that I might be facing in my life, and then if I start to notice a shift in my feelings like that, what should I do about it?
That's a great question. In terms of things you might experience yourself, you might feel like you're easier to anger. You might notice that your sleep is disrupted. You might notice that you're not sleeping as well. More difficult to concentrate and more difficult to pay attention for longer time periods. Increased arguments with a spouse or someone that feels close, and feelings of loneliness. And last, you might notice a change in your appetite. You're beginning to overeat or just not feeling hungry when you normally would be having 3 square meals a day.
What about other people? What about our loved ones, coworkers, friends, people you might not be seeing a lot of right now because of social distancing, but how can we stay in touch with them, recognize any struggles they might be having, and make sure that they're coping okay with this as well?
Yeah, other things you might notice in family members would be that they're, calling you an excessive amount, always having a new worry or how do they handle this situation. You might notice similar things with them, that they're not sleeping as well. I think very important for parents to know about their children. Things are going to look a little bit different in a younger child and in teenagers. You might notice that they're having increased tantrums and excessive crying, that they might have had a little regression in some of their developmental behavior. Previously had been potty trained, but now wetting the bed. Previously going to bed on a regular schedule, but now really struggling with nap times and bedtimes. You might notice that you've, asked them to do chores and complete tasks, but they're not able to keep up with that any longer. In our older children and teenagers, you might see that they're experimenting with tobacco, alcohol, or drugs, making decisions that they wouldn't have made just a short time ago. But with that anxiety, it's, maybe reducing their ability to make a solid decision.
We are, we're a social species here. We need our exercise. We need to interact with other people. I think you've seen complaints. Some people aren't taking social distancing serious enough, but I think on the opposite end of the spectrum, some people are just too afraid to even get out of the house. What's the safe medium here where we're still getting out, getting our exercise, and obeying the social distancing guidelines?
Yeah, in terms of safely getting exercise, many times going on walks in neighborhoods is just fine. You may briefly pass someone on the sidewalk, but you're really not spending a significant time around them. I've certainly had conversations with my neighbors from driveway to driveway, and I think that's a safe thing to do. Hikes are a wonderful opportunity. You may see one or two people for an entire hour-long walk on a trail. So that's an excellent way to get some exercise, stimulate your metabolism, and release some of that stress and anxiety. It gets you away from the indoors. It gets you away from the TV screen. Can be a really healthy activity for you.
Some great ideas there. I want to switch gears here real quickly for one last question. The governor announcing just this afternoon a lot of help from the state for healthcare facilities and workers as well. Things that include funds for facilities to set up isolation areas for potential COVID-19 patients, some additional pay for nurses that could come from the state, as well as funding for nursing homes that might be dealing with an increased amount of COVID-19 patients. How can some of this support from the state level really help you guys out right now?
I'm really excited that the governor and the Arkansas legislator was able to make some of these maneuvers. I think that's just going to be incredibly important. Sticking on anxieties, our healthcare field is having a lot of stress and pressure right now too. And so if we can relieve some of that and relieve some of that financial burden from our healthcare providers, incentivize our nursing and healthcare professionals by offering them, money to work in these fields, or if they're in these fields, to further support them as they're going through these trying times. I think that's, incredibly important, and I'm really happy that Governor Hutchinson was able to make these moves.
Okay, that's all I got for you today. We know you all are working hard, and I'm sure healthcare workers among some of the people facing the most stresses this time. We just really appreciate all your effort right now. Absolutely. Hug your friends that are nurses and medical assistants and lab technicians and doctors. Reach out to them and see how they're feeling. This is certainly a stressful time, and take the same care for yourselves. Thank you for having me on. All right, Dr. Berner, take care.